Everyone, and welcome. If you are connected, we're broadcasting this One Health webinar, Intersectoral Approaches for One Health. Greetings to all of you, wherever you are located, both the participants and the speakers. This is being broadcasted through YouTube in Spanish and English. You can always select the language of your preference. You can always follow us on the FAO website. You can use the YouTube chat pod at the bottom of the screen, and you can ask your questions in your own language. And we will have a Q&A period at the end of the conversation. There will be contents shared through the chat. If you don't remember the name of the speaker, you can quote him or her by the area or domain. You can make your comments using hashtag One Health and hashtag Better Production. This is part of 7 webinars between 2024 and 2025. One for the FAO regional offices. This is the first open meeting. And then we've 5 additional webinars to address each one of the dimensions of One Health: the livestock, agriculture, forestry, and aquaculture, and gender. Eventually, we will be sharing the dates for the webinar, so pay attention to that. Let me introduce the speakers. This will not be presentations, but this is a conversation. We'll have 4 specialists, one per each domain. For livestock, we have Andres Gonzalez. He's the animal health official for Latin America and the Caribbean. Aquaculture, we have Jose Alegar. He's the officer for the region. Agriculture, we have Gamini Manuera. He's a consultant from the suicide from prevention from Edinburgh. Natalia Caro Marimon she's with the FAO. Having said that, let me welcome all the speakers. We will have 5 questions, 3 minutes each. So let's go ahead and start. First question, and this is animal health. If we consider One Health as a coordination mechanism for the problems related to ecosystem health, considering humans, flora, fauna, and environment, what aspects of this approach would you highlight that reflect the importance of intersectoral coordination? Thank you, Nicolas. Greetings, everyone. It's pleased to be here with all of you. Like Nicolas said, the goal is to guarantee the opportunity to engage from different sectors as part of these webinar series addressing particular topics on One Health strategy. Let me take Nicolas's question. It has to do with coordination and the importance of these intersectoral coordination. But let me first remind you that what is it that for FAO involves One Health. This has to do with a comprehensive unifying strategy to guarantee the balance and sustainability of health, people, environments, and animals. But recognizing, and that's the added value of One Health, recognizing that there is not only engagement but also interdependence. Since this is not just interaction or engagement, we find multi-sectoral challenges that requires actions from the multiple sectors and dimensions. And one of these factors has to do with coordination, like um, like Nicolas just said. So coordination, if we go back to the global action framework, which is part of the governance this strategy requires for implementation, it's a coordination among multiple stakeholders. However, this is quite challenging, especially, like many of you know, when implementing this, it requires agreements. It requires description of the coordination mechanism, and this is not always the case. So, from the point of view of animal health, going into the animal health issue, this coordination may take place, as it is the case, may be formal or informal. There are certain guidelines for coordination, for collaboration, but when these take place, most interactions are informal or agreed upon when reacting to a given situation. And for this, let me use the example of this is a real life example of something this is happening right now in Latin America and the Caribbean, which has to do with the reemergence of a parasite-based disease, the borer worm. In 2023, it reemerges in Central America. This is a parasite based by caused by flies or uh, which affects hot-blooded animals, including humans, of course, and not only affecting health, but also production and food security because it has a direct impact on the production of food. Because animals for production cannot gain weight, and this will cause death and will also affect not only big production units but also those animals which are grown in an artisanal way, which it's part of the direct formal life of thousands of people in the region. So this disease is being reintroduced in the region, and the identification and the response to the emergency requires not only veterinarians but also public health of officials, biologists, entomologists, professionals from ecosystem protection agencies. So this multiple group of professionals with multiple background and expertise, they require a coordination mechanism. And one of the main paths to control this disease is through nuclear techniques. Think of a veterinarian or a public health official. How much can they know about techniques to produce or to carry out one of the disease control, which is the release of sterile diseases to control populations of these type of flies. So these coordination can take place with a prior preparation. It's impossible to implement these upon reacting to the emergency. And coordination requires the definition of responsibilities of stakeholders and the roles, not only during the response and the control of these zoosanitary event, but also during the planning of the response. So again, the interdependence of factors will allow for a multi-sectoral challenge can have a better response.
Excelente, muy claro, muchas gracias Andrés.
Great, quite clear,
Eh,
Andres. Thank
tenemos
you.
hoy en día la
Now,
acuicultura
today we
constante
have
siendo bien
aquaculture with a
popular.
great challenge and opportunity
José,
as well.
¿qué
Jose,
particularidades o
what
qué comentarios tiene para
what would you
vincular la
say
acuicultura en
from
el marco de la
aquaculture in the
salud y
framework of
esta
One Health
coordinación
and
intersectorial?
these intersectoral
Sí, muy
coordination?
buenos días a todos y todas y
Good
muchas gracias
morning,
por la
everyone, and
invitación.
thank you for the
El concepto de
invitation.
una salud en la
One Health
acuicultura, en
in
esencia y
aquaculture,
en breve, busca
in
promover
short,
prácticas
aims at
sostenibles y
promoting
resilientes.
sustainable practices,
Ahora
sustainable
son
and resilient
varios los
practices.
temas transversales
Now,
que
there
son
are
relevantes para la
multiple
agricultura en el ámbito
topics
de la
cutting
salud
across
y quiero
aquaculture within
destacar
One Health.
cuatro de ellos
But
que
let me
también tienen
emphasize
gran relevancia
four
para otro
weaknesses
sector.
which are relevant for other
El
sectors as
primero de
well.
ellos, el primer tema, es
Number one,
en la acuicultura,
in
es el que
aquaculture
equilibrar el
is to
aumento del
balance
consumo
the
de carne
increase
que
of
debemos hacer
consumption of
por razones de
fish
salud,
because of health reasons,
equilibrar esto
to
con
balance
la
that with
sobreexplotación por parte de los productos del mar,
overexploitation from overfishing.
también el aumento de la
The
producción agrícola que
increase
debemos
in
tener y todo
aquaculture
esto
production,
equilibrado
and
con,
these
obviamente,
everything
tener cuidado
in
con los
perfect
impactos
balance
ambientales que
without
terminen. Ese es el primer punto,
affecting the
cómo manejar el
environment.
consumo de
So, how to
pescado
increase the
y al mismo
consumption
tiempo
of
proteger el
fish,
medio ambiente.
but also protect the environment.
El segundo tema transversal, también de
Number two,
relevancia en todos los sectores, es el identificar y comunicar
identifying
los
and
riesgos a la salud
communicating
humana.
risks for
En
human
el caso de
health,
la acuicultura,
in case of
derivados de los
aquaculture,
contaminantes
from
que
pollutants
normalmente se encuentran en los productos del mar.
found
Y
in
también, al mismo
sea
tiempo,
products,
impulsar
and also
estrategias para mitigar
finding
este tipo de
strategies to
riesgos.
mitigate these type of risks.
El punto número 3,
Number three,
también de gran relevancia, es desarrollar y promover
developing
métodos de
and
producción
promoting production
que
methods
reduzcan o
that will
eliminen la
reduce or
necesidad de
eliminate the
antibióticos,
need of
pesticidas
antibiotics,
y otros
pesticides,
productos químicos
and
que
other
pueden
chemicals
tener
that
un
may
amplio alcance en la
have
salud
a
humana,
wide
de los
reach to human
peces y
health,
del medio
of
ambiente.
beach health, and
Y
the
el cuarto,
environment health.
también
Number four,
importante, es el poder encontrar
being able to
alimentos para animales
find
que sean
food for
ecológicamente
animals which
sostenibles
are
y
ecologically
seguros con
sustainable and
niveles
ecologically safe with
aceptables
acceptable
de uso de
levels
nutrientes
of
saludables
nutrients
y compuestos
and
de relevancia. Entonces, estos
relevant
son
components
cuatro
or
temas
contents. So
transversales
those four
importantes para
topics
la
cut
acuicultura, pero
across
también, como
aquaculture,
podrán ver, también
but
gran
as you can
relevancia para
see,
otros
are
sectores.
extremely relevant
Muchas
for the
gracias.
other sectors. Thank you very
Muchas
much.
gracias, José. Está claro por estos
Thank you
cuatro
so much,
puntos
Jose. It is very
hay
clear from the
dimensiones que se
information you have shared on
sobreponen
these
y
four
agencias que
items
van a tener que
that
cooperar
there
entre
are
nosotros,
overlapping
obviamente, el
topics
consumidor
and
y la
also
sociedad
agencies that
civil.
need to help both the and
Para un
including the
expositor de la
consumers and civil
agricultura,
society in this for our
we know that
agriculture
people usually
presenter.
perceive agriculture as a risk under one health perspective. How can we illustrate us on this approach on agriculture, on this intersectoral coordination on agriculture production, horticulture, and so on?
Thank you very much for the question, and thank you very much for inviting
Muchas
this
gracias por la pregunta y por la
important
invitación a
webinar.
participar en este webinario
So,
tan importante.
agriculture is a vital
La
component in One Health
agricultura, obviamente,
in the
es uno de los
context of
componentes dentro de
good health
una
and
salud.
well-being. It is a major source of food and nutrients for humans. So, agriculture also has associated, unfortunately, with many potential risks to human health if not properly managed. Therefore, collaboration and coordination among agriculture, health, environmental sectors are extremely important. One of the major concerns of agriculture is the use of chemicals, especially pesticides, and in some cases, fertilizer as well. Knowing that pesticides have potential not only to cause acute poisoning, in many events which will end up in death, but also linked to serious chronic diseases such as cancer, kidney failure, endocrine disruption, anxiety, depression, etc., etc. There's a lot. So pesticide can have adverse impacts in two major ways. One is the thing that we normally know, that direct exposure, the farmers or farmer communities through intentional, accidental, or unintentional exposure, or the other source is through residues in food, water, and as the previous speaker mentioned, from aquaculture and other areas. So they are the consumers in general across the country. So it is not only affecting the farming community, the pesticides are affecting the entire population with respect to One Health aspect. So this is very important. Just to add, understand the gravity of this problem, let me just share some numbers. In 2016, over 4 million tons of active ingredients alone has been used across the globe. That's a huge amount. Over 385 million poisoning cases globally happening every year. Children and women of childbearing age are more vulnerable for pesticides. We all know that. Over 10,000 accidental deaths happening every year due to pesticides. And some of the things, one other thing number is that, sometimes, people most of the time ignore one thing, which is very important. Over 160,000 people die each year by committing suicide using pesticides, which is an area where we most cases ignore. And then, of course, the other unfortunate problem is that most of these things are happening in low and middle income countries. So that is very unfortunate. And the other thing what we need to understand here is not all pesticides are causing serious problems. Of course, they have adverse effects. But there are few highly hazardous pesticides posing the main problems in this sector. And the other unfortunate thing is we often see these things are still in use, including in the Americas region. So that is something that we need to be very careful, and we have to be mindful and do something that as soon as possible, because it is extremely important. Highlighting a little bit about the indirect health effects through adverse impacts of pesticides on agroecosystem is another concern. Because if you use excessively pesticides, they can create certain pest resistance, so that we need to use more pesticides or more chemicals, or sometimes go into these genetically modified crops, which are also having a lot of problems with health and well-being. So these are some of the areas where misuse of pesticides can also cause serious problems. I'm not going into details. These are just the tip of the iceberg of what's the problems with pesticides in general in agriculture. And there are solutions, of course, and these solutions are broad across the country, across many sectors, as well as across many topics, and these have to be addressed in a very coordinated and collaborated manner, so that we can find solutions. I'll stop right now, and we can go into the details later. Thank you.
Thank you, Gamini. Entonces, está clarísimo que de esta visión del área de agricultura, la necesidad
So it's clear that the approach and the view from agriculture takes into account the impact on food safety and the misuse or unexpected use to attempt against the health of the population is evidently clear. So the focus and the need for having intersectorial help is important. And of course, in all these matters that impact human health. So in this first question, we get to the forest related questions. And in this case, forestry production and the just production of commercial lumber, how is that linked to health, and what is the approach from an intersectorial point of view? Thank you, Nicolas, for that question, and thank you for inviting me to this webinar. To answer that question, I would like to first begin saying that One Health in this aspect involves understanding how important healthy forests are for human health and environment. We get food, lumber, and other ecosystem services that they provide. And they also protect us against health. And they're crucial when it comes to the fight against climate change. The protection and preservation of forests and the practice of livestock production, and of course, grazing activities and the relationship between wild fauna and forests are elements that we need to take into account. And the example that I gave about the manufacturing process that involves forestry products, that affects not only the soil, the diversity, but also they have a link between people, animals, and trees. And it benefits not only people, but also the ecosystems in which we live. The forest, as I mentioned earlier, is an essential element for our mental, physical health because it gives us a place for recreation and also exposure to natural elements for people. And it has a link to our identity and the identity of our communities because they are part of our history. Therefore, just to round up my message, although the forests and disease that affects trees don't impact directly the population, the loss of diversity and forest degradation do have an impact on ourselves, our welfare, and our health. So, in addition to that, the forest degradation can lead to some spills, just as was mentioned by Andres in his presentation. So, the sustainable management of forests and forest health are necessary to maintain the health of ecosystems and therefore the health of human populations. And that's why we need knowledge from different groups and different experiences, like, for instance, agriculture, all the grazing activities, forestry, livestock, among others. Thank you so much. Very clear, Natalia. Thank you so much. After finishing with this first question, what is clear is the need for interdisciplinary and intersectoral collaboration. It is clear that there are many challenges in this need to continue feeding a world population that is increasing, and we need to minimize these impacts and work jointly when health is at stake. The second question, from this approach of relations, it is clear that this dimension is important, but there are critical elements that must be taken into account. In the area of aquaculture and agriculture, the 5 items were mentioned, and we are sure that there are critical things to highlight, but we would like to focus or for you to focus on the ones that are more relevant for our audience to be aware of.
Sí, muchas gracias, Nicolás.
Thank you so much, Nicolas.
En el ámbito de la agricultura,
In general, in aquaculture,
el enfoque de una salud
what happens is that the One Health approach is done
extensivo, semi-intensivo o
just looking at the whole system,
Aquí lo importante es
intensive
que estos sistemas
production, extensive production. So these
se tienen
production
que tomar en cuenta
systems
desde un nivel
must be
ecosistémico, es decir, no se
considered from an
trata de un sitio en
ecosystem
particular, se
point of
tiene que
view. It's
entender
not
que
just one single site.
sistema forma parte de un
We must
ecosistema
understand that systems form
y
part of
y
a
es así
whole
como se
other
tiene que abordar.
system, an
¿Cuáles son
ecosystem,
los
and that's the way they need to be
puntos
approached.
críticos
I
que
think that
quiero
the three
resaltar?
critical items
El
I would
primer
like to
punto
highlight are the
claramente
following.
es
The
la
first
comprensión de la
is for
interacción entre
sure
las personas,
the
los animales, las
comprehension
plantas y
of
los
understanding
ecosistemas
between animals,
y hacer lo
plants,
mejor posible para
the
que todas y todos
ecosystem,
entendamos
etc.
bien
to do this in the best way possible so we can understand those interactions. And the second one has to do with the timely acknowledgement of the fact that there's a problem related to disease and the correct diagnosis of the cause of that disease and the application of a management practice, and above all, control and proper treatment. The third item that I would like to highlight, and that has been already very well explained by Nicolas and Andres, and what has been said about this is the need to strengthen multidisciplinary work, work that is well coordinated and that is focused on One Health. This is key, obviously, to achieve the goals of One Health. Thank you so much. Thank you, Jose. And in livestock production, land animals, sometimes that is very much related to wild fauna. Is this a critical point, Andres? And if so, what is your take on that critical point, or in any other that you consider relevant? Well, as regards to wild fauna and its role in a multi-sectoral type of approach, this adds more complexity to the response that an action management under One Health may have. That is to say, when we talk about wildlife, until recently, it was only considered part of the ecosystem. We knew it was there, and we knew that it had some role to play in the supply chain of wild life, and that it had a contribution to the enrichment of the ecosystem or to the enrichment of landscape. And that then it evolved and we began to speak about biodiversity, but it was only until recently that in a great effort, the information was published about the economics of biodiversity. We're not only talking about the former information, there were numbers assigned to this. Economically, this was evaluated to say how much biodiversity costs, or worse, how much we would lose if we lose biodiversity, setting a number to that. So beginning from there, we began to talk about the ecosystemic services or ecosystem services of wildlife and then diversity, understanding that wild fauna, speaking of course about wild animals, have a value that is usually underestimated or not considered as to what they contribute to the ecosystem and the health of the ecosystem and the environment and the population. And that has to do with the production of food items and the maintenance of a balance and equilibrium in the environment. At the same time, that balance or equilibrium can be affected by a pathology, by an infectious disease or not. I will take the example of the high pathogen bird flu, a viral disease that has been discussed at length in our region, because beginning in 2022, we had mass dissemination of this disease in the countries in the Americas, not only Latin America and the Caribbean, but also North America, where more than 18 countries in all the Americas and 16 of them in Latin America and the Caribbean have had cases of this type of bird flu that has affected wild fauna and livestock also. And there have been, of course, unfortunate losses of human life. So it can affect people, animals, but also people. So this disease between October 2022 and November 2023, in that single period, it affected the lives of over 600,000 wild birds, about 82 species, and over 50,000 wild mammals. involving 10 species.
This, we know now that this has a cost including not only what may have an economic value, but also a cost for the ecosystem and a cost for the guarantee of the balance of such ecosystem. We understand that the control of these diseases for wildlife has nothing to do with what we had to do with production. We cannot unpopulate a country or a territory from wild animals. That's impossible. Plus, if wild animals move freely through territories or countries without any type of control, well, we're talking about the cross-border capability of wildlife for the dissemination of diseases. So again, let me go back to the scenario in point one. We have border control agents, we have marine biologists, we have other types of biologists, ground biologists. We have specialists in bird migration, specialists in interaction of birds. But again, coordination will be necessary in order to address this. And last but not least, we have to understand that wildlife is contact in this interface with production animals, but also with humans. We have a lot of human beings living in areas where there is direct contact with wildlife. So it is impossible to think that one single professional or group of professionals will be able to address, react, respond to this emergency as the one we have lived in the region. So how to have a comprehensive response to control this? Well, we've been doing this mostly as a result of improvisation. Because of the needs, we have seen interaction of animal protection services, wildlife services, veterinary services interacting that this as a result of these need for response, and that today what we want is to learn from these lessons and try to make these coordination mechanisms official by improving the governance of One Health strategy in order to protect the ecosystem. Thank you, Andres. Quite clear your answer. Natalia, for forestry, much of what we talked in wildlife has to do with forestry, but how about what environmental factors, such as climate change, may be related to in forestry and the One Health view? Thank you, Nicolas. Well, climate change, it's a critical challenge for forest systems because it affects the resilience of ecosystems to face the effects of native or non-native pests and diseases, as well as invasive plants. These impacts, in turn, will emphasize food insecurity and negatively affect human, animal, and environmental health. Climate change and extreme weather events may create more favorable conditions for proliferation of pests and diseases, weakening forests and trees, such as water regulation, climate regulation, air purification, and the provision of wildlife habitat, the essential ecosystem services. So these are multi-sectoral impacts, and this is connected to raising the trees. Yeah, but we see how this silvopastoral livestock will where we can see the impacts of climate change, and we see how we work together in forestry and grazing in order to bring sustainable solutions. So we need coordinated multidisciplinary approaches to mitigate these effects and promote the sustainability and overall health of ecosystems and local communities living on those ecosystems, which is all of us. We all depend on forests and the balance in the forestry ecosystems. Thank you.
Muy claro, Natalia. Muchas gracias.
Quite straightforward, Natalia. Last but not least,
thinking on agriculture,
Gamini.
it's clear that the stakeholders and the need to cross-sectoral interventions is clear. But if we think about fruits and vegetables, you have been mentioning about pesticides and fertilizers. How are the labs and producer association and consumers involved or critical points in this manner?
Thank you. I think it is a very critical question. I think it is very important for everyone to understand what's the situation here. Let me start with the Producers Association first. As I mentioned, still there are a lot of very highly toxic chemicals are used in the region. So these are there's a huge role the Producers Association can play to sort of address this. So one way to address is, I know it is very challenging because their target is to produce more and have some economic impact benefits. But still, what we know from the experience from across the globe, at least you can start first with the highly hazardous pesticides. You can you can take them out and you can sustainably develop and work with generate more food production without compromising. So I think, if I may, I would say the Producers Association should, with an ultimate goal of going towards organic and eco-friendly farming, should start prioritizing at least to eliminate the use of highly hazardous pesticides, and also to practice good agricultural practices like proper applications and then proper protective equipments, etc., which is very important. And we know that in most of the countries it doesn't happen, especially in the rural area. So this is something that we have to promote. It not only these good agricultural practices help protect the farming community, which is very important, but also ensures that what they produce don't have exceeding amounts of residues that the consumers are going to be impacted, unfortunately. So this is the second level. So connecting with these residues, there's a huge gap in the knowledge, especially in developing countries. What's the residue levels, and what are the most critical chemicals, and what are the most critical producers that we have to be careful. So there's a huge gap in data. So the laboratories can play a huge role. I know that it is a challenge because these need a lot of technology and a lot of capacity and a lot of things. So there's a need for the policymakers to support strengthening the capacity. We can discuss about later, but at least I think that's an area we have to sort of strengthen and generate more data. One thing what I have to highlight here as well is that there is a gap between the dialogue of the scientific community and the policymakers. Policymakers sometimes don't have the clear understanding of what this data mean. That is understandable. So it's important for the scientific community to interpret what this data shows, what this data says. That is extremely important. And at the same time, policymakers should highlight what are the priorities at national level, so that the researchers and laboratories can focus on the national priorities rather than doing two different things. So these are the areas where they have to collaborate and coordinate between the technical the sector as well as the policymaking sector. and harmonize this. This is a very important role. Last but not least, the consumers. They should definitely strive to understand what are the risks associated with pesticides exposure. It is very difficult and very hard. I know this is a huge gap here again about the communication and awareness. The consumers are unfortunately always not aware the vegetables they are eating or something else, how to protect themselves and their families. So this is an area where the media and social media and other platforms should play a key role now, and to communicate and make them aware of what are the risks and how to protect your family. And also, the consumers have a huge role to play to inform the policymakers that we have this problem. Maybe it is a communication problem. Maybe it is high levels of pesticide residues in their plate. So policymakers to take proper action to protect them, because sometimes policymakers are focusing on many other aspects like the economy and other things, but not so much about these things. So consumers, because they are the policymakers have to come to the consumers when for their support for their elections or whatever. So in that area, so they have to they can play a role in that area as well. Briefly, this is what I would like to see. I only focused on the highlights and the most important things, and we can discuss later if there are any other things. Thank you so much for this question.
Thank you, Amiri. Con esta segunda pregunta nos quedó claro la necesidad
we see now the need of this intersectoral approach, and that problems are quite different and challenging. Therefore, we have an open invitation to have this interaction, these joint address efforts to prioritize and have build synergies in every area. Remember, this webinar is being recorded, that this will be made available at the FAO platform for your questions. So we have over 50 people in attending the webinar, and like to invite others through the hashtag Una Sola Salud and Mejor Producción. We know that we need have this interaction and
open the door to
can
this need of public policy and decision makers. And it's clear that the government is there, and we used to think as the government as the ones that is responsible for public goods. But we believe they are not the only one that should take action or be responsible for this. So within agriculture, how can we think private sector and civil society to as key players to equally set the agenda or make the public agenda ahead?
Thank you. I think this is where I just wanted to lead into this discussion, because it is always sometimes, unfortunately, we believe as citizens, government has to do everything. But the government has a limit that they can do. They can make policies, but policies are implemented and practiced by various different sectors of the society. And especially the private sector, when it comes to pesticides, can play a huge role. And because the industry is, because of the nature of the industry, what they do is they always go through this distribution and sales of pesticides. They have channels, and then they have marketing and promotional campaigns on pesticides. So these things have to be in accordance with the local regulations, and to make sure that human and the environment is protected. So they have to take into the account of these health aspects, health implications of distribution, sales, promotion, to be done in a more responsible manner, so that we are protecting the human and the environment. So this is extremely important. First aspect. So when they are promoting, they are doing their business, we respect their business, but only thing is they at the same time be mindful about the adverse consequences that can have if it is not properly managed. The second part is actually a key role again the private sector can play here is to transit from all these highly hazardous or hazardous pesticides or hazardous chemicals into eco-friendly products. This is the long-term sustainability. Even that's for their business also. It is going to be a very much sort of prospective future for them to sort of invest on eco-friendly, sustainable pest control options to be in their business package, so that eventually it goes to benefit both consumers as well as the industry too. When it comes to the civil society, I think civil society has a lot to play in this discussion and conversation. As I mentioned before, awareness raising among farmers or consumers and other key players. And one of the things that I think I have to highlight here is that the civil society can highlight where the capacity gaps are, where the things not really happening, and to make aware even the donor communities to consider supporting where it is needed, the priority areas. And the other thing is intersectoral collaboration and coordination. The civil society can play a huge role here because there is always a tendency that the different sectors are working in silos. So the civil society can bridge this silo and come up with something that is more workable. And the other aspect is about they also can contribute a lot on surveillance and monitoring. So they can play kind of a very important role. What's happening in the field, in rural areas, and alert the agencies for necessary action. So these are some of the areas where they can sort of do some surveillance systems and data collection, and understand what's going on and inform different stakeholders. And the other thing is also they can play a huge role in influencing policy dialogue in many levels, higher levels at government level, on different sector level. They can contribute a lot. We know that the civil society has a key role to play in all these areas in communication and coordination. In brief, for now, thank you.
Thank you, Gamini. Natalia, la vinculación de agricultura y forestal.
Nali, the link between agricultural and forestry production, there's a very important role, according to Gamini, for civil society. And what about the ecosystem services? What role does the civil society and the private sector play in this linkage between them to determine the public agenda on the governance of the forestry sector in One Health? Thank you, Nicolas. I would like to begin by providing some background. In many countries, this forestry production is managed by the private sector. And then on the other hand, we have local communities, we have indigenous groups and civil society in general that play an important role in the sustainable management of forestry. of the forestry industry. The private sector has an interest in providing innovation technology and financial resources for the development and implementation of sustainable management solutions for the management of forests, because of course they want to be able to use those resources in the long term. And so they aim for having sustainable practices. And by using these technologies and engineering practices, they can improve the health of ecosystems. On the other hand, we have civil society, local communities, and indigenous groups who are important to include in the surveillance systems for forests, because thanks to them, we can strengthen the response capacity to pests, diseases, and different issues occurring in different regions. This ensures resiliency and sustainability of ecosystems in the long term. By saying this, I mean that when civil society and local communities and their users are included in forestry protection activities through the dissemination of information on good practices and the inclusion of them in activities for protecting forests. And of course, we create shared accountability, shared responsibility over these resources that are essential for our welfare. And in addition to that, if we don't include the local groups, civil society, and indigenous communities, we cannot ensure that the initiatives linked to forest protection and for developing the One Health agenda, we can't expect it to be possible, because we all need to contribute to make that possible. All of us who benefit from healthy forests have a responsibility in the protection for such resources. Thank you so much. Thank you, Natalia. Andres, thinking of animal health, the government has, of course, a clear role in the responsibility of that, and of course, with the veterinary services that are provided. But what is the role of individuals and people at large when we have this One Health view or approach? And what is the role of the individual as a responsible party that sometimes is not clear on their role within the system? What can you say as regards that? Your mic is muted. Yes, my apologies. I will divide my reply in two parts. I will try to add to what my colleagues have so clearly stated. I will start with the institutional side of this reply. There's a global action plan for the implementation of the One Health strategy that until very recently was led by three agencies: FAO, the World Health Organization, and the World Animal Health World Organization. And recently we have included the environmental component through the UN Program for the Environment. I won't be looking at each of the action lines in these initiatives, that there are 6 lines of actions. The one I will dwell more, what I will dwell more on are the pathways that are 3 to achieve the necessary change to get a multisectoral intervention and solution. Well, the first one has to do with governance and regulations. The second one has to do with the organizational development and the integration of different stakeholders. And the third one has to do with the data collection and knowledge management. I will dwell on the second one. Organizational change that is required for the One Health approach to be possible begins from the grassroots. from the very basic elements of society. A couple of months ago, I was with an anthropologist, a friend of mine, who is in charge of looking at and analyzing behavioral changes required for the One Health approach to be implemented in the different levels and in the different population strata. For instance, a veterinary in an agency is not usual for them to talk to an anthropologist, to be able to increase biosecurity or to handle the fact that sometimes, airlines may have plant-based or animal-based foodstuffs that can affect the local production, or how do we manage, to have people report diseases to veterinary services? So it's not very common for an anthropologist and a veterinary to come together to do this. The behavior change is part of the great changes that must occur. And besides, we need much more an open mind. That's what we need. And we need to also be humble. I, as a veterinary, don't know so much about behavior changes, but in such drastic and technical aspects that we need to deal with in veterinary services, that requires, understanding by the consumer, by the value chain stakeholders. So taking into account that these actions will have an impact not only on the lifestyle of the population, but will also have an impact on the health and welfare of such population. On the one hand, we need to acknowledge the restrictions we have in our professions and the corporate needs of including new expertise in the implementation of this strategy. So I wrap up my answer by saying that the global action plan is very well defined. The only thing we need now is to be humble enough to accept the help from collaborators that are new or that have recently become part of this discussion, in the understanding that their contribution amplifies and improves all the work that can already be done by the environmental public health agencies. Thank you so much, Andres. Very good approach. And that clearly has to do with the fact that the government, of course, is made up of individuals. And it is those individuals that also need to think about how, rethink the way they are approaching issues, not from their own niche, from their own silo, but opening up to other professionals so that that can lead to better governance in One Health. Thank you so much for your comments. And Jose, as a participant in the area of agriculture, we're also sure that the individual has a role. What is your take on that, on the question of governance?
Muchas gracias, Nicolás.
Thank you so much, Nicolas. There are 3 points that I would like to get across. The first one that Andres so well illustrated, and it's one of the most important one, has to do with communication among different sectors. And that is absolutely necessary. It's absolutely necessary to come up with a common, simple language which helps us understand each other among different sectors. It's not easy to hear for us who work in agricultural technical terminology from veterinary doctors or experts in agriculture, so on and so forth. So I think that having one common language will enhance our communication. And I think, and I assume that that is part of the global action plan that Andres has just mentioned. The second point is that governance a robust type of governance. It's absolutely essential, and it is necessary for that type of governance to strengthen and promote interinstitutional work. And it's important for all these sectors to be talking to each other and working with each other, and for commitments to and agreements be reached together where these institutions, agencies, and everyone work under one single goal. And under this strengthened governance, we can improve coordination and early alerts, early warnings when it comes to timely response to health emergencies. And the third point I would like to make is the importance of developing the necessary skills by offering training and to identify early on multiple risks that under One Health in aquatic animals, and obviously for the preparation and early implementation of measures to respond to emergencies related to all of these aspects. So that's why I highlight the need for these development skills.
Thank you, Jose. Let me revisit that, which is really interesting. The capacity building, One Health challenges these joint approach between sectors and disciplines. This invites us to rethink the training of professionals and the building of capabilities, not so that each stakeholder acting on their own, but in order to improve the intervention and the synergies from these joint effort. Question number 4, there's a human thing. We humans tend to underestimate the seriousness of problems, and thus delaying decision making and preventive management. Natalia, in forestry, this underestimation thing, what would you recommend to the stakeholders so as to avoid thinking that climate change is not such, it's not that serious, and adopt proactive actions on these problems as referred to as part of One Health?
Gracias, Nicolás. Bueno, como
Thank you,
mencionaba,
Nicholas. As I
agricultura es
said,
una fuente vital de alimentos y de nutrición.
forests are
Los
a vital
salvajes
source of food and
naturales
nutrition. They are the
ayudan a
natural
asegurar y
pharmacies.
mejorar
They
nuestra
protect
salud
us from
mental y
diseases. They
física y
improve our
desempeñan
mental
un
and
papel
physical health,
relevante
and they
contra el
play
cambio
a
climático.
key role in the
A
fight
veces,
against
para
climate
recordarnos lo
change.
grave de la situación, tenemos que
Uh,
escuchar algunos números
Sometimes
sobre
we
lo que
have to
estamos
listen to
perdiendo.
them,
Entonces,
some
los
numbers.
bosques ahora mismo necesitan de nuestra
Forests
ayuda. Entre
need our
2015
help
y
right now.
2020
Between
perdimos 10
2015 and
millones de
2020, we
hectáreas
lost
anuales de bosques.
10 million hectares of
Además,
forest that were
alrededor de
lost per year
35 millones de hectáreas de
annually.
bosques son afectadas por las quemas forestales
Insects in
cada año.
forest areas damage
Y desde el
around 35
2015
million
perdimos
hectares of
alrededor
forest. In
de 98
2015,
millones de hectáreas de bosques alrededor del
fires
mundo por el impacto de los
affected
incendios.
approximately
Entonces,
98
a
million
través de
hectares of
políticas
forest
federales
worldwide. So,
para el
through
sector forestal y
forest-friendly
una mayor
policies
intervención y una
and
mayor
increased
inversión en los
investment
bosques,
in
podemos
forests,
proteger a nuestro
then we can protect
planeta.
our planet and we can
Para poder
protect our health.
abordar la salud de los
To
bosques desde el enfoque
address
de una
forest
sola
health from a
salud y
One
acordarnos de
Health
su importancia,
perspective,
es esencial
it
adoptar
is
un enfoque
critical
sistémico
to take
que
a
comprenda la
systems approach
complejidad que
that
hay en la
will understand the
interacción entre las
complexity and
personas, los bosques y los problemas
interconnection,
medioambientales.
interrelationship of
Esto implica
forests, people, and
traer
environmental issues. This
las experiencias
means
y los conocimientos desde otros países, desde otras áreas, para
bringing
trabajar juntos y
information
afrontar estos problemas a causa ambiental. Hay
knowledge from
otros,
all
como por
different
ejemplo los
areas.
castores invasores de
Uh,
los bosques en
for,
Argentina,
for instance,
semillas portadoras de
those
hojas
faced
y
with
frutos
invasive beavers in
dañinas, los
Argentina,
brotes de
leaf cutter
escarabajos en
ants
la
in
corteza, en el
Brazil,
corredor
the bark
seco
beetle
de
outbreaks in the
Centroamérica,
Central American dry
dañan las
corridor,
plantaciones forestales y
affecting
alteran el equilibrio
forestry
biológico.
and
O por
affect
ejemplo,
the
vemos el caso
biological
en Asia de la planta
balance. In
invasora
Asia,
Cerastabilis, que está
the
afectando la
Senna spectabilis in Asia, an invasive species that negatively affect the wildlife feeding. Elephants cannot eat. This plant is taking all, the elephants do not like this plant. So this shows that we need to work together. We need to integrate multiple perspectives to face these problems and work on sustainable solutions. Now, from the forestry aspect, it's also important to promote the creation of early working groups and surveillance groups in order to face and to carry out activities for the protection of forest health, of invasive species or native pest outbreaks. We need to raise awareness, and we need to educate of the interdependence of ecosystems health, create collaborative networks, and do research, do monitoring of these problems and how they connect each other. We need to promote the creation of policies addressing ecosystem health in a holistic manner. It is clear, and we need the experiences from multiple areas, but we cannot neglect the fact that all these knowledge needs to be integrated and to address an ecosystem as a one single element. And in FAO, we're making an effort to address those similarities in forestry health. We have created 5 regional networks on forest health and invasive species in Asia Pacific, the Pacific, Europe and Central Asia, Africa, the Middle East, and Latin America and the Caribbean network. These networks work as under One Health in order to disseminate technical information for the protection of forests, and this is a platform to build capabilities in different regions. We've seen how they're sharing their experiences from Asia Pacific with colleagues in Africa or in Latin America. So it is important that not only remember what we're losing, but also set clear goals as to how to work together, because if we work together, we can emphasize the importance of these issues. Thank you.
Gracias, Natalia.
Thank you, Natalia.
Gamini, on the same page on this
Gamini.
Normal situation on underestimation and problems, and trying to illustrate on how to not to fall on this hole and this situation. I'm thinking on pesticide and this disclaimer that usually we get of they are registered, they are labeled, they have clear use indications. How can we think agriculture and this normal underestimation on pesticides are not really a problem? How we can make recommendation on try to take it seriously and start working with this One Health and intersectoral approach?
Thank you. I think, you cannot take this thing as granted. As I mentioned, the numbers at my first intervention, I don't want to repeat that. There's a huge problem with agriculture, with especially respect to the chemicals used in a very uncontrolled manner. So this has to be somehow addressed, because the numbers are really bad. I think, as Natalia mentioned, the approach is ecosystem approach and intersectoral collaboration. These are repeated. I mean, every speaker was highlighting about it. Let me just take one example how this ecosystem approach or the multi-sectoral collaboration will help beyond just having a label and letting people to use whatever they want. If you look at the health sector has all the information. At least health sector can collect all the information about poisoning incidents happening in the country, because when there are poisoning incidents, the patients go and report to the health facility, and therefore they have the numbers. I know most countries, some countries have their systems in place to collect this information. And some countries, unfortunately, don't have that system in place. Even if it is there, it is not working properly. And the other thing is, sometimes what happens is you have all these things working properly, but they don't coordinate with the policymakers from the pesticide right side. That these are the problems. These are the problem chemicals. These are the most dangerous chemicals in my country, in our situation. So these numbers are critically important for policy decisions, because you cannot just take policy decisions simply based on some reports in the newspapers or something like that. They need hard evidence. So the health sector can play a critical role collecting this information and transforming this, sharing this information with pesticides and regulatory bodies, so that they can make critical decisions on how to manage these things. An effective awareness campaign, I don't want to repeat that again. And this, the other thing what I would like need to happen is, as I mentioned before, or allocation and investment of adequate resources for these things. It is extremely important that each different sectors, health, environment, agriculture, at least looking into the priority areas and make necessary allocations and investment into these resources, so that they can at least start with the basic things. So this is what I think is necessary beyond having, because we know basically the pesticides labels are there in the laws, and it is happening for 30, 40 years. But the problem is still there. So we need to go beyond that, definitely. So that's what my response to your question. Thank you.
Thank you. Andrés, tenemos en
Andrés, we have along the same lines of underestimating the problem in the case of animal health. Bacteria, viruses are part of the natural biology, and their interrelationship with humans. What would happen if we go ahead underestimating and doing nothing, acting on our own best interest without really considering that this requires further attention? Unfortunately, when we get the attention of high-level decision makers, is because we're talking about financial resources, losses, and we do have tools that will allow us not only to assess the future and the past of what the cost could be for a zoosanitary event, what would be the cost of acting or not acting. And these type of tools, FAO has some, not the only one, but FAO has measures to have tools to measure modeling the impact of introduction of a zoosanitary event that will allow us to negotiate, not only assuming that these will be affecting the production, that will have an impact on animal production, because at the end of the day, especially public sector, when they discuss budget, the person when you discuss budgets, it's from the treasury, it's from finances. So the language we need to use to show how relevant, how important it is to avoid silos. Could be an infection that could affect animals, people, the environment. That language is something that we need to improve. It's something we're all learning, and unfortunately, learning based on negative experiences after outbreaks or zoosanitary events. We haven't been ready enough, trained enough. But now we have those lessons learned. Let me address the importance of strengthening early efforts through contingency plans, through to readiness in case of sanitary events, potential introduction of diseases, or these type of uh, of emergencies or outbreaks is just the effect on animal species or a group of animal species, but eventually this may become a nutritional crisis, a social crisis. So we need to understand the effect. It's not limited to the health of animals and people, but may also affect the food security. And there is where ongoing training, the capacity building, identifying those action niches that we can enhance the early warning and emergency response systems will guarantee, and in fact, there are some rough numbers and that show that for each dollar invested in prevention, around $5 or $10 are being saved in terms of emergency control, the emergency response. So these numbers allow to show what we mean by the early action, anticipatory action, and the capacity building supported by a financial component, so that when negotiating, those that speak a different technical language will be easier for them to understand in order to strengthen One Health.
Thank you so much, Andres. Is wonderful. And the mention of the economic costs that are added to what we have is expenses in health is very timely. And now, Jose, who's our last presenter for the last question, are you clear on the fact that aquaculture ecosystems also involve a cost when production is affected and the health of aquaculture species is affected? So the question is, from this point of view, from economic and non-economic costs. Well, Andres's opinion is very much spot on. And there are many things that not only the agricultural industry needs to look at. I underscore the fact that we need to make estimates based on the territories or the sea territories. And also from an ecosystem point of view, I would like to highlight two aspects. One is the importance of raising awareness among everyone about the care of these ecosystems, either aquatic or land systems. Education at all levels, schools, and with children and decision makers and the people who work in aquaculture, but all throughout the value chain. That's the main point. The second point is that it is always important to remember that we must pay careful attention to the bee producers who work in, or the aquaculture experts that are the ones that will be at higher risk if there's no support provided in a timely and efficient way. Thank you, Jose. And I would like to highlight that we do have small holders and small communities that always are the weak link in the chain. And from this health perspective, One Health perspective, we need to look after them also. And now we have this last question that I will connect with each of the presenters so that they can offer their final recommendations. But with a question from the chat, section that somebody's asking about recommendations or in what way governments can begin to work on the One Health approach and what programs exist in each of the domains. So my question, Jose, I begin with you, is what would be your recommendation to facilitate for governments, of course, taking into account that everybody has something to do in this aspect, but as a government, to be able to start in aquaculture, to lead in the One Health approach? Well, many things come to mind based on what has been said. For sure, there are four that I can think of right now. The first one has to do with strengthening and promoting the ecosystemic approach at the land and sea level. And also, and the second aspect is to carry out careful planning of our spaces and also time planning for time, taking into account all the impacts we have based on the climate change effects. And for all productive sectors to have good production practices. It has been mentioned several times, the fact that pesticides are used in agriculture, but all productive sectors have their own impacts. So to see how we can improve that situation, so each production sector can improve their practices to prevent impacting the valuable ecosystems we all have. The fourth one has to do with seeking practical and sustainable solutions that are directly targeting the different health-related issues that are sustainable and environmentally friendly. And to wrap up, an example that comes to mind and that is extremely important in aquaculture is the bloom of noxious algae. And that is seen when there are environmental parameters, for instance, the decline in rainfall or an increase in temperature, the algae population then blooms excessively. Some microalgae species that affect both the environment, people, and also aquaculture species. And under One Health, this is extremely important. And for those of you who are not familiar with the impact that these algae blooms have, not only in aquaculture, but in everything else, I invite you to Google that information, especially in noxious algae blooms. If you Google that term, you will find some very interesting information. Thank you so much. Thank you so much, Jose. Now we move on to Andres, and I repeat the question once again, that is just to offer conclusions on what is required by the government, and here we can highlight the existence perhaps of an example of one or maybe multiple programs that are already being implemented, and then also highlighting a recommendation as to what the governments need from the health, livestock, agricultural approach to actually move forward with the One Health approach. Thank you so much. This has been such an interesting conversation. I have learned so much from my colleagues, particularly in areas that one never finishes learning from. So being able to nourish ourselves with this information is extremely important. It will not only feed information for our own institution, but also will help us provide technical assistance to countries and to anyone that reaches out to FAO requesting technical aid or assistance in these matters. I would like to wrap up by saying, or by mentioning, a couple of slides I have been presented as OLED. That's the high-level panel for the implementation of One Health. It's OHHLP. And in that initiative, they use hundreds of studies, worldwide level studies, and these are cross-cutting type of studies. to see what will be required. The first has to do with the absence of regulations and standards that favor our work. We can continue working in an isolated basis, in some, that's what I can say. And regulations don't really help integration. And the second has to do with the formality of coordination, because most of the coordination that exists between the different sectors that collaborate with One Health is informal and is more um, of a type of individual action rather than a group effort. And there's something that is quite important, which has to do with the distribution of the financial resources used to support the One Health approach that continues being unequal. We have areas where we receive or know that there's far more funding, like in the sector for public health, compared to that for animal health, aquaculture, species health, and ecosystems. That such inequalities lead to an imbalance in power and in decision making. And therefore, until we can distribute these financial resources more in a more balanced way, we won't be able to make any, get to any positive results in One Health. And there's very little accountability of what we can do or not in the workforce, so that it leads to a weak workforce. If I have questions about what my role and responsibility is in this multi-sector action matrix, leads to the fact that at the end of the day, I don't know what I am accountable and responsible for. And then my contribution to the One Health approach might be compromised. I would like to add to those challenges some opportunities that have also been detected and that can impact different areas. These have to do, and in response to the challenges, I might say, they have to do with generating integration between and among institutions in multidisciplinary agencies through regulations. Anything that is binding or regulated usually involves faster steps to accelerate everything at a public level and at the level of society as a whole. And then we need to pinpoint the action items or the inputs that we can impact in service without stopping the ongoing process. So we can include elements that may have an impact and ensure integration, but without stopping the process, without saying we'll start from scratch or doing things totally the different way, but rather than just continuing in the process and making changes while the processes are still ongoing, not interrupting them. And then at the end of the day, we need to define the objectives and maybe as clear and measurably as possible to improve the responsibility in each of the stakeholders and people who work in the implementation of One Health, so that at the end of the day, by gathering that information, we can assess not only progress or maybe also detect why we're not progressing, if that's the case. Thank you so much, Andres. Very insightful, very clear on the step-by-step approach, very clear diagnosis also. Natalie, I imagine that a lot of this has to do with the forestry sector. What can you add then from the forestry sector perspective and the need to actually implement actions? Well, the One Health approach highlights the connection between the health of people, animals, and the environment. But also, it represents a platform that is valuable to care for these resources and to be able to share knowledge, capacities, and to share funding also to carry out these activities. Each of us can contribute from our own areas, since expert knowledge is essential to face these challenges. Collaboration among different experts is absolutely necessary, and working in such a way we can establish links and connections to protect these interconnected systems. I saw that you asked about what FAO is doing in this front. They have a multiple risk table or that is being used to join efforts from different areas and begin to connect the risks that come from forest to animals and to people. And what is also being developed is a biosecurity integrated index that brings all these areas together so that the countries can understand what they need to work on still to be able to attain complete biosecurity. And something that has already been said in general, the important takeaway from this is that we need to communicate better, join efforts, and understand how our actions and decisions impact the system as a whole and not only the areas we work in. Thank you so much.
Thank you, Natalia. Yes, it's taking responsibility. We're not alone here. Individuals, we're all part of a system. So, like that closing remarks. Gamini.
Maybe has the same as Andres and Natalia mentioned. Could you give us some recommendation or final comments on how agriculture and One Health go hand in hand and how to move the agenda and start moving ahead on One Health and agriculture?
Thank you. I think a lot of things mentioned already, so I don't want to repeat what is already said. They are all applicable to agriculture as well. Two things, if I may add, from the agriculture point of view. When the agriculture policies are made, they should look at not only agriculture, they should look across all the other sectors, like health, like environment, maybe forestry and animal health. So it is sometimes lacking. So, when it's conventional that, each sector is looking at policies within their sector, not looking at the outside of their system. So I think this is something that is critically important. The second one, what is something that I thought maybe we should look at is just look at ourselves. What can I do individually at many different levels? You, the listeners, or someone, I can play a role that is different from everybody else's because we have all our own role. Have you played that role effectively? Is there anything you can add on? So this is the last comment I have to say. One thing what I forgot to mention is that when it comes to pesticides and all these toxic things, there are a lot of tools, as in the other cases. FAO has developed a lot of criteria and various different tools, guidance, how to identify these chemicals, and even WHO and other areas. And also we have number of conventions looking into these things at global level. So these are some of the things that we can have a lot of support in this policy making and actions, and then we can come up with a global impact on One Health in the real world. Thank you so much, and good luck. All the best for everybody for this giving me opportunities. Thank you so much.
Thank you, Gamini. Bueno, de esta manera terminamos las 5
Well, this is how we have finished all 5 questions. I have here a short summary. We have had several aspects of these opportunity of One Health for each one of the 4 domains, so that from our role, wherever we are, from our activities as a civil society, as consumers, producers, government, whatever the role we play, One Health is an opportunity to rethink ourselves, rethink as individuals, rethink ourselves in the way we carry out our activities. And that, for sure, was made quite clear that there are opportunities for improvement so that the result is good for everyone, good for the ecosystems, good for a better production, good for resilient systems. And there was this question in the chat referring to how gender is part of it. Gender cuts across of it. And this has to be part of the discussion, like communities, indigenous communities, and the whole system has to be addressed. So we hope this conversation brought the questions to rethink ourselves. Changes are not possible unless we move. So I hope this was the first step. Let me offer some final remarks. We have exhausted our time. We have more questions in the chat pod that we will uh, answer in the coming webinars. I'd like to thank you for your participation and be ready to attend the next webinars. You may download the certificate at the website of the events. The YouTube chat will be open so that you can sign in and get your certificate. The recordings will be available for questions and comments. Clearly, would like to thank your dissemination efforts through hashtag one health and hashtag better production. Remember that FAO is here to support, and every organization has contents and reference material and lots of inputs that may be useful wherever you are in order to address in depth these topics. And I'd like to thank the speakers, or to thank the attendees, the participants. We had over 50 active participants, and of course, this webinar will be recorded, and then this will be part of the advocacy as a part of One Health. Without further ado, thank you. Have a good day, and we'll see you in the next One Health webinar for the improvement of productivity.